Tracy is Coordinator of Health and Safety Services for the Elementary Teachers Federation of Ontario. Tracy's experience as a secondary science teacher led her to become a health and safety activist. Her union experience expanded to workers' compensation, disability issues, political action, and bargaining, before focusing once again on the prevention of workplace injuries and illness as a staff member in the Health and Safety Services area of the Elementary Teachers Federation of Ontario as the coordinator. She's an instructor for the Workers' Health and Safety Centre and the OFL's Prevention Link, sits on the board of directors of OCAL and the Workers' Health and Safety Legal Clinic, and is a former chair of the Windsor and District Labour Council's Day of Mourning Planning Committee. Tracy's work is based out of Provincial Union Office in Toronto, but she still considers Windsor her home with her partner and 2 children. And she's here today representing ETFO. We're so happy that Tracy was able to be here today to speak to the education or to the experience of educators. So thank you, Tracy.
Thank you, and thanks for the invitation to share the effect of the pandemic on education workers. I'd also like to thank Tyler for using the data to push back on the moral panic, which many in the government use to push for schools to be open and for the return to open without precautions. So that's very much appreciated. I will start with a quick update on the current situation in schools for some context. After an introduction to the Canadian Teachers Federation survey results, I will focus most of the presentation on the pandemic experience survey with OCAL and the Institute for Work and Health. I will then share some of the experiences from the frontline education workers advocating for change and exercising their rights, and then review some of the strategies ETFO and other unions continue to use to support members. Last April, during an OCAL webinar, I presented some of the lessons learned in the public education sector in the first year of the pandemic. Well, as most of you are likely aware, I can report now that the government has not learned from their mistakes, and they are repeating them. They have now hid the data and removed precautions again too early. Up until January, Public Health Ontario reported the provincial data, including the number of outbreaks by setting. This was the situation at the beginning of this school year, up until the increases of cases prior to the holiday break. The last few weeks of the data in 2021 on this graph were not reliable data, since reporting was limited when schools were closed and the government decided to stop reporting COVID cases in schools after this point. Currently, schools have high absent rates and the reasons are not being disclosed, and there is no longer any contact tracing. Some parent groups are pushing back on this with their local school board and health units. In the last few days, the Dufferin-Peel Catholic Board and the Toronto District School Board announced that they will be sharing cases with parents again. It is now April, and the education unions continue to push for the Ministry of Education to send clarification to school boards that as employers, they must still notify staff of potential exposures and notify joint health and safety committees of occupational illness. Wastewater began to indicate an increase in COVID levels even before the mask mandates and other precautions were lifted in schools, particularly in the northern parts of Ontario. Some of the differences in risk levels are also very localized. Schools in more affluent neighborhoods have higher vaccination rates and fewer COVID cases for a number of reasons, many overlapping with equity issues that Taylor touched on, and also Birgit will be discussing some of those in her presentation. Staff in some schools are at more risk than others, but the government has told school boards and local health units that they must follow the provincial directives. Although last year, many school boards put additional masking precautions in place for younger students, and some eventually made N95 respirators available to school staff before the province did. Only one school board has defied the province's recent expectation to remove the mask mandates. The Hamilton Wentworth District School Board had continued the mask mandate until April 1st. They understood their obligations for staff and student safety and the government's lack of power to enforce their unofficial directives. It is still unclear legally how the government is interfering with Public Health Unit's authority to issue local Section 22 orders under the Health Protection and Promotion Act. Unfortunately, the Hamilton Wentworth Board has now changed their messaging to just strongly encouraging masking for students and staff. Many education workers who understand the risks to themselves, their students, and the community have had their mental health affected again by the removal of these precautions. They are not only worried for the acute response of the infectious disease, but also the possible effects of long COVID, which can be debilitating and affect cognition. In October 2020, the Canadian Teachers Federation collected data from 13,750 teachers across the country through the Teacher Mental Health Check-in Survey. Some of those teachers also participated in interviews earlier this year, which resulted in a follow-up report entitled, "But at What Cost?", including some qualitative analysis of the ongoing mental health impacts during the pandemic. Of the teachers who completed the initial survey, 70% were concerned about their own mental health. The results detail unbearable levels of stress, anxiety, and a struggle to cope with the demands of teaching during the pandemic. 1 in 3 teachers indicated that they were barely coping. 1 in 3 found juggling responsibilities very to severely exhausting. 41% found trying to maintain a positive and energetic attitude greatly affected their mental and emotional health. 1 in 3 teachers rarely got enough sleep, hydration, proper nutrition, or found time to exercise in their daily schedule. The visual on this screen are some of the recommendations from the Ctf Mental Health study. There are more detailed recommendations with each of the reports that were released throughout the year. Of course, one of the recommendations is to increase funding and visibility of mental health supports for teachers and students. Many of the CTF recommendations to support teachers' mental health include supports for students' mental health, since that assists educators in doing their job. But there also needs to be mental health supports for educators themselves, which is often ignored by governments, even though supporting educators will help them be able to support their students. One of the examples of policies, procedures, and resources that could be developed include new mental health resources to address impacts of the pandemic through trauma-informed practices. This is very important since anecdotally, workplace violence has increased post-pandemic, and it was already at a concerning level before the pandemic. The government must listen to teachers' experiences and recognize the long-term cumulative effects of being a frontline education worker in the care community. Additionally, more than 5,000 ETFO members participated in OCAU's Pandemic Experience Survey. OCAU and the IWH also had the survey open for healthcare workers earlier in the pandemic and for all workers in Ontario at various times. The purpose? Exploring links between safe work practices and workers' mental health. ETFO Health and Safety Services staff worked with the researchers preparing the survey and analyzing the results. The individuals listed on the slide were involved in ETFO's survey analysis, but we should also acknowledge the many healthcare unions and other advisors who assisted in the initial development of the Pandemic Experience Survey tool. I have taken most of the graphics from previous presentations made by Peter Smith and John Odike during OKID webinars, but I will focus on some of the key points that were interesting from a union health and safety perspective. John is also part of the webinar today and can assist with any questions. The survey link was made available to over 83,000 ETFO members through several routes in November and December of 2020, at a time when COVID rates were beginning to rise significantly, as can be seen on the top graph. The bottom graph shows that cases in staff at schools were also rising at that time. And you can also see that shortly afterwards, there were almost no cases reported in schools, since after the holiday break, most students were learning remotely, similar to what happened again this year. The survey examined the relationship between perceived adequacy of personal protective equipment and workplace-based infection control practices, ICP, and various mental health indicators within the context of the COVID-19 pandemic. Some of the questions are from the internationally recognized Copenhagen Psychosocial Questionnaire, also called COPSOC for short. And even prior to the pandemic, many of the questions have been part of OCAL's mental injury toolkit and stress assess tool. For the ETFO survey, the questions about working from home were expanded and educator-specific questions were added. The questions to evaluate generalized anxiety disorder, GAD-7, and the Patient Health Questionnaire, PHQ-2, are reliable survey tools also used by Stats Canada, which provides us with comparable data from surveys done with the general public before and during the pandemic. These were the scales that participants used to evaluate their PPE and infection control practices, with green indicating all of their needs for PPE or infection control practices being met. Looking specifically at the types of PPE, the vast majority of members in 2020 reported that they were unsure if N95s were appropriate, or they believed they were not applicable. Early in the pandemic, shortages discouraged people from requesting respirators, and healthcare workers are still struggling to access them. Droplet dogma led people to believe that respiratory protection was unnecessary. At the time, the Ministry of Education was just starting to consider them as necessary for aerosol-generating medical procedures in schools. ETFO and other unions were advocating for the precautionary principle and the recognition of aerosol transmission. Throughout the last year, many of our members eventually realized that the medical masks did not offer adequate protection against an airborne virus. Our members were most satisfied with the hand sanitizer that they were provided, but some still had concerns about that. Only 73% reported an appropriate type and adequate supply of paper towels, and only 68% reported adequate access to soap and running water. This was after the school boards had months to ensure infrastructure and supplies were in place. These results are concerning, since access to proper hand washing should always have been in place, even before the pandemic. Eye protection was a significant concern due to the poor quality face shields that fogged up and offered little protection. Eventually, most school staff were offered the option of goggles or safety glasses. As you can see, there is less green on this graph, which indicates there was less satisfaction with the infection control practices compared to PPE. The only category that the majority of our members felt was appropriate and adequately implemented was their coworkers wearing face coverings. The majority had some level of concern with students wearing face coverings, the screening of students, physical distancing of students, cleaning and disinfection, and various protocols to reduce contacts, such as cohorting and scheduling. One concern that we had with the results was that only 13% felt that the ventilation was appropriate and adequately implemented. 52% expressed concerns about the appropriateness of the ventilation, its adequacy, or both. And we were surprised that 28% of respondents were not sure that the ventilation was appropriate, and 7% felt ventilation was not even applicable. Hopefully, since then, our efforts have helped to raise awareness of the importance of ventilation. Comparing the overall results of the previous two graphs, at the time of the survey in the fall of 2020, ETFO members were more confident in their PPE than other infection control practices. While 29% of respondents felt that their PPE needs were met, only 4% felt that all their needs for infection control practices were met. Over 2/3 of respondents did not feel that the needs for infection control practices were met. In terms of basic health and safety principles, including the hierarchy of controls, infection control practices should have been prioritized. In health and safety, PPE is usually considered the last line of defense, but when the government and employers were not implementing adequate infection control practices, the workers depended on their PPE. Moving on to the survey questions which evaluated anxiety and depression, the data verified that the concerns that we had heard from our members were significant. While the responses to these screening tools do not indicate a diagnosis, this is a reliable initial assessment of symptoms. Respondents who indicated moderate or severe symptoms of anxiety or depression are at a level which indicates they should be seeking professional help. Screening levels among education workers were 60% for anxiety and 46% for depressive symptoms. This was even higher than in the similar surveys of healthcare and non-healthcare workers that were conducted earlier in the pandemic. Stats Canada also used the GAD-7 measure of anxiety at the beginning of the pandemic in the spring of 2020 and found 18% of Canadians reported symptoms of moderate to severe anxiety in the previous 2 weeks, which is significantly less than education workers at that time we did the survey. Unadjusted rates of positive screens for anxiety and depressive symptoms were strongly associated with perceived needs not being met for both PPE and infection control practices. The researchers then adjusted the data for a number of variables, and a clear graded relationship was observed in all samples between adequacy of infection control practice and anxiety symptoms. While the purpose of providing PPE and implementing infection control practices in workplaces is to protect workers from COVID-19, not adequately providing PPE and infection control practices not only increases the risk of COVID-19, but it is also associated with symptoms of anxiety. When looking at these graphs, it's important to remember back to the analysis of the previous questions, which indicated that 2/3 of respondents had less than half of their infection control needs met. This graph shows that those individuals, a majority of our respondents, had significantly higher proportion of moderate to severe anxiety scores. Having less than half of infection control needs met was also associated with more than 3 times the risk of moderate and severe anxiety. In addition to the members who were working in schools, many of our members were working remotely with students participating in virtual classes. Those members also reported significantly higher levels of anxiety and depression than other working groups outside of the education sector. We have heard from those members that the workload skyrocketed for those teaching remotely and that they felt isolated and unsupported. Also, many of our members who were not working had the highest rates of anxiety and depression, which may have been related to the reasons they were not working. For example, if they were on a leave since they or someone in their family were immune compromised. Remember from a couple slides ago, the Stats Canada survey found that only 18% of Canadians reported symptoms of moderate to severe anxiety in the spring of 2020. So at the time that this survey was taken, significantly more of our education workers reported those symptoms, regardless of their working arrangements. Since many of the COPSOC survey question tools were also used in an ECO survey in 2019, we can compare the results to the rest of the population before the pandemic. As you can see from the amount of red on this slide, the educators revealed their perception of work-related factors to be much worse than the average on almost every scale: quantitative demands, work pace, predictability, and role conflicts. We will look at the various sources of support in more detail on the next slide. The survey questions on burnout found a significant difference in the response between the genders. 79% of women answering our survey and 71% of men had a burnout score of 75 on a scale of 0 to 100. Respondents in this survey also reported significant levels of sleep disturbances and fear. There are important differences in the psychosocial work environment between online and in-person educators, with those engaged in online learning having more quantitative demands, higher work pace, less predictability, and more role conflict. Those engaged in online learning also had less support from supervisors and coworkers. Colleague support was quite positive, though, for on-site respondents. Burnout and sleep symptoms were quite high, particularly for those respondents working remotely. The 2019 Canadian worker average for burnout was 50 and 54 for education sector before the pandemic, but 78 for in-person educators and 83 for online educators during our pandemic survey. We were glad to see the majority believed that the unions were doing their best to protect them, while a third believed their employer was doing their best, but only 6% felt the government was doing their best. In the Canadian Teachers Federation survey, over 60% of teachers across the country felt not supported by their Ministry of Education, and Ontario educators felt even less supported by their government. When compared to the respondents of OCAL's other pandemic experience surveys, those on-site, working remotely, or healthcare workers, fewer education workers felt their employers and their government were doing their best to protect them. Why might this be? Healthcare facilities have always had some degree of infection control practices before the pandemic, and this was new to education workers. And the government repeatedly supported healthcare workers in the media while referring to selfish teachers' unions wanting to close schools, instead of acknowledging the need to make them safer to keep them open. In general, respondents were also asked to rate the psychological health and safety climate in their workplace, and the results were significantly more unfavorable than Canadians who responded to the same question in the ECOS poll in 2019. Far fewer educators reported the psychological health and safety climate of their workplaces as healthy and supportive or good, and significantly more educators reported their workplaces as not so good or poor. Members in hybrid work situations rated their psychological health and safety environment the most negatively. But since that time, school boards expanded the use of hybrid learning based on government expectations, expecting educators to teach in person and be responsible for students in a virtual class at the same time, an incredibly impossible task that also does not serve the interests of students. ETFO released some of these preliminary results during Mental Health Awareness Week last May. Despite the concerning results showing the magnitude of the problem, there was little to no reaction from the media. We also shared the information with the government and education stakeholder groups at the Provincial Working Group on Health and Safety several times to back up our requests for additional safety precautions in schools. The researchers from OCAL and IWH have submitted 2 research papers based on the responses from ETFO members. Both are still in the peer review process. Hopefully they will be published soon. So watch OCAL and IWH for details. Another question that was included in the pandemic experience survey dealt with how participants felt about exercising their right to refuse unsafe work. Oftentimes, this is the fastest way to ensure a hazard is addressed in the education sector. Although we encourage members to use the internal responsibility system first, the majority of the recommendations through a joint health and safety committee are not supported by management, since school board employers usually respond that they are meeting the minimum standards. The survey results indicated that our members were more likely to consider a work refusal if they felt their PPE was inadequate than if they felt the infection control practices were inadequate. This may reveal the reality that PPE was the focus of most MOL inspectors while they investigated complaints and work refusals, even though the MOL focused on workers' compliance and not about the quality of the PPE that was provided. Almost a quarter of respondents indicated that it was not likely or they would definitely not exercise their right to refuse, even if they felt the infection control practices were inadequate, which, remember, the survey also indicated that 2/3 of our members felt. So even if that many members indicated that they would exercise their right to refuse, why didn't we see more work refusals? Why aren't educators likely to exercise their right to refuse? There are a number of reasons that we hear. Most commonly, teachers have a limited right to refuse under the Act and are discouraged from doing so by their principals, since it is very inconvenient. And educators entered a caring profession and often sacrifice their own safety for the sake of the students in their care. Even more concerning is the response that 6 to 7% of our members did not feel the option to refuse work was even legally available to them, despite all of the information that unions have provided to our members. Much of the reason for our members not exercising their rights is the lack of support from the Ministry of Labour for those who tried. Even before COVID, educators struggled to have workplace violence addressed by Ministry of Labour inspectors. With COVID, the inspectors' initial response was similar, that there was no proof that the hazard was in the building, even at times when there were high rates of COVID in the community. Most of the Ministry of Labour's visits to schools were reactive, not proactive, and even when they responded to a work refusal as a complaint, very few orders were written. And generally those orders were not directly related to the concerns expressed by the education workers. Education sector health and safety reps have also participated in research being done by Professors Alan Hall and Eric Tucker. Their preliminary analysis has indicated that during the pandemic, the education sector had fewer visits and a lower overall ratio of orders to inspections, arguably reflecting a particular reluctance to intervene in the education sector. We did see 31 work refusals in the education sector up until the beginning of March of this school year. Half of them were in the week following the reopening of schools in mid-January. We anticipated more work refusals when the mask mandates were removed in March. But if there were any, not one of the provincial education unions were notified or involved. Some of our members may have been misled by the government and Chief Medical Officer of Health into thinking that schools were now safe. We believe that other members with concerns felt defeated and knew the Ministry of Labour would not support them. Unfortunately, the risks are still high, and the Ministry of Labour is currently investigating another death to an education worker due to COVID, likely contracted at work. In last year's webinar, I provided an overview of the education sector's first year in the pandemic, sharing our frustrations with the lack of support from the Ministry of Labour inspectors. Slowly over the year, we found some success with the Ministry of Labour pushing employers to complete occupational illness reports and provide ventilation reports. But they didn't do this through orders. For example, the Ministry of Labour insisted that school boards provide ventilation reports during stage 1 of a work refusal and would not come into a stage 2 investigation until they had been provided. Alternatively, the education sector unions and parent groups found some success working with school board trustees to focus and force the school board administration to put in place protocols that went beyond minimum standards and follow the precautionary principle, using political action instead of their legislative rights. But recently, the Premier has even put a stop to that, and school boards now feel their hands are tied again. Education unions supported our members with information about their rights at various times through the pandemic. The visual on this slide is one of the web pages on etfohealthandsafety.ca with resources on workers' rights. ETFO started with a tip sheet for members in the summer of 2020, followed in the fall by the OFL Guide to Education Worker Rights. In the spring of 2021, when rates were rising again, ETFO produced a short video on work refusals and a checklist for members to self-evaluate their situation. COVID was the predominant topic of all of our health and safety training over the last couple of years, with a lot of material from OCAW and the Workers' Health and Safety Center on PPE and ventilation. Podcasts and webinars and checklists were also being created by grassroots educator groups, which had a significant following on social media. So in the health and safety world, we proactively support members by providing trusted information, advising local Joint Health and Safety Committee representatives, and sometimes appealing the lack of Ministry of Labor orders depending on the circumstances. Other ETFO health and safety staff assist members with their WSIB claims and appeals. We have had an increasing number of chronic mental stress claims. As a union, we show support for members' concerns through public statements or other political actions such as lobbying for change, which will help make schools safer. Often when we think about supporting members with mental health concerns, the first thing we think about is providing them with direct wellness resources and referring members in need to medical professionals or support organizations. Programs such as Mental Health First Aid can help union representatives with this. ETFO members also have access to supports through staff at our provincial office for advice, through their benefits plans, and through their school board's joint employee assistance programs. The ongoing monitoring of mental health of workers is warranted since finding solutions requires acknowledgement of the problem. As with any hazard in the workplace, after you identify it, it is important to do some research and develop a plan to assess the extent of the hazard. OCAW's new guide to the Mental Injury Toolkit will help anyone interested in trying to assess psychosocial hazards in their workplace and includes suggested changes to implement and then reevaluate. More information can be found on the OCAW website. The Stress Assess survey tool can be set up for a workplace analysis online or can be used as an individual. And it is also available as a downloadable app from the Canadian Centre for Occupational Health and Safety. A comprehensive approach to mental health in the workplace must include all levels of prevention. Interventions must be organizational and individual. Primary prevention directs the intervention at the source of the problem. Secondary prevention detects early signs of harm, indicating a need to address the source. This could include a review of lost time claims and absenteeism. Tertiary prevention provides help once the person is harmed. Using the hierarchy of controls, the most effective way to address any workplace hazard is at the source, which means primary prevention at the organizational level to address some of the work-related risk factors. OCAW's Mental Injury Toolkit and Stress Assess are excellent resources to help. The Workers' Health and Safety Center also offers a 3-hour module to explore psychosocial hazards and workplace mental health. Registration is currently open for the virtual courses in April and May. ETFO and other unions have also worked with the Ontario Federation of Labour on this psychosocial hazard resource. The Ministry of Labour's 5-year strategy includes an emphasis on mental health, but we need to push to ensure that psychological injuries are treated in a similar way to physical injuries, with prevention as a focus. The surveys have been an important tool in the education sector to assess the psychosocial hazards during the pandemic, only part of our overall strategies to support members. As you can see from my presentation, I need to thank my colleagues in the education sector, the OFL Health and Safety Committee, and our partners at the Workers' Health and Safety Center, the Institute of Work and Health, the OCOW, and the Canadian Aerosol Transmission Coalition, all who have provided us with ongoing support. We would have never been able to support workers through the pandemic without the level of collaboration that has occurred. Of course, we wish our prevention efforts would have been more successful, but you can only imagine how much worse it could have been without our collective efforts. So I am open for questions now, or we can wait until the panel afterwards. Thanks.
Thank you, Tracy. We have one question in the chat right now from Kevin Hedges. Do you think that mixed messaging played a part in anxiety? For example, aerosol transmission versus droplet dogma?
Yes, absolutely. I think our members were confused. We tried to educate them as much as possible, but you know, the media did not focus on aerosol transmission at first, and it took a long time for them to look at that. And definitely the survey back in 2020 showed that our members were quite comfortable with the level of protection that they had, and we had already been telling them that we should be considering N95s. That was a decision to keep N95 as one of the options in that survey question.
Okay, thank you. We're gonna hold, I see there's a question. We're gonna hold the rest of the questions for the end, but please, anyone else, throw your questions in the chat now. We will get to them, so please go ahead and do that.